Hi, my name is Dr. Eric Janowitz, and I am the founder and clinic director here at Synergy Oviedo Chiropractic. Now, a lot of people ask me, when involved in a car accident, who are the different doctors that I should see? And even more importantly, when should I see them? So the first thing is, if you had a car accident, if you're at the site and it was an emergency, if you suspect a fracture or bleed, then you want to be seen in the emergency room. Now, thank God most of the car accidents today, because the way cars are built and designed with crumple zones, really prevent a lot of those life-threatening conditions. So thank God to our engineers and our automaking industry. However, because of that fact, many injuries become soft tissue injuries. Now, just because they're soft tissue injuries doesn't mean that they are less serious. In fact, most of the chronic pain that people are dealing with today are a result of soft injuries. You know, a fracture to a bone heals in weeks. A ligament sprain can take months to heal, and even sometimes over a year to heal. So there is a lot more in terms of the length of time that those types of injuries can occur. So I always say, and think about this, if you baked a cake, right? Sequence matters, and who you see matters as well. So again, if it's an emergency, see an emergency room physician, get that emergency solved, make sure that it is stabilized. After that, many people might think of going to their primary care doctor. Now, your primary care doctor is designed to just kind of triage in that aspect there, but a lot of primary care doctors don't even accept auto accident cases, at least here in Florida, because there's the med legal aspect and there's the therapy aspect of it as well that their offices are just not designed for. So they're going to give you muscle relaxers and anti-inflammatories and see how you're doing with that. The problem is are those things, although helpful with the symptoms, are they really correcting the underlying cause of the problem? And you probably know the answer for that, right? So then where do I go next? Do I go to an orthopedic surgeon, right? Orthopedic surgeons do orthopedic surgery, or neurosurgeons do neurosurgery. So they're going to see again if you are a surgery candidate right there. And fortunately, at the very beginning, most cases are not surgical cases. Now, it doesn't mean that you may need, unfortunately, surgery later on in your treatment, but it should not be the first step in that assessment because it's just not what they do. There's a sequence of these things. So then the other aspect that people look at is pain management. Now, I think if you watch any of the news today, you see that there is we went through this major opiate crisis. Florida got hit one of the hardest. More opioids were consumed in the state of Florida and prescribed in the state of Florida than all 49 states combined at the height of this crisis. And a lot of the opiate crisis came about because people had injuries, either work injuries, car accident injuries, back injuries, and spine injuries. And so in an effort to try to feel better, they took a lot of pain medicine and progressively got stronger pain medicine until they got to the opiate level. Now, the best way to prevent that is never even to enter that cycle. And of course, I don't want anybody in pain, but if we can solve your pain naturally with not the addictive properties of strong pain medication, I think we can all agree that going that route, at least not initially, is a great way to go. It might be later on again in the orthopedic and surgical realm going that direction, but not necessarily at the first. Now, that leaves chiropractors. So chiropractors are trained in providing care that is specific to musculoskeletal issues, and car crashes cause a lot of neuromusculoskeletal issues, problems with the nerves, the muscles, the skeletal structure, the discs, the joints, the ligaments. They're very well suited to take care of those injuries, and their offices are designed and structured to be able to give you the therapy on an ongoing basis to help rehabilitate you, to get you through the relief phase of your pain, to get you to corrective and then strengthening that so that you can be at your best. Now, a good chiropractor also has built up a network over the years of knowing which other doctors, like the orthopedic surgeons, the neurosurgeons, the neurologists, the pain management doctors, all these other providers, to be able to give you comprehensive care. But the chiropractor can serve as a quarterback. Now, that being said, you got to make sure that you find the right chiropractor for you. So it's important that you look in your geographical area and search for chiropractors in your area. It's important that you read the reviews of the office. Look at Synergy Oviedo Chiropractic, for example. You want to make sure that that doctor has extra training in these types of injuries. Some doctors focus on sports, some doctors focus on pediatrics, some doctors focus on geriatrics, some doctors focus on auto accidents. I took the most advanced class on whiplash and traumatology because I wanted to become an expert at this so that we can properly and expertly and most efficiently take care of the injuries that we see from auto accident cases. So there is a lot of players that could be seen. The important thing you want to see is that whoever you see is going to dictate the treatment that you are seeking, right? It's going to provide that treatment. So if you see an orthopedic surgeon, it's typically surgery, or it could be epidural injections. If you see pain management, it could be medication. And you want to try to do the most conservative methods first and get more aggressive as you need to. But first try the conservative method. So I'm Dr. Eric Janowitz with Synergy Oviedo Chiropractic. I hope this information was valuable for you and can really help set the stage in getting you on the right course of treatment if unfortunately you had a car accident. Thank you.